Commonly used saying, and personally one of my favorites, is that your actions will always affect other people. Whether this person is affected negatively or positively depends on what exactly those actions were. A term that can be used to describe this is the ripple effect, and it is very relatable in everyday life. The ripple effect occurs when one action made by one person affects another person, or it affects multiple people. I'm Elizabeth Roebuck, and while I studied the NICU this year during Biomed, I became very interested in learning about fetal alcohol syndrome and how much of an impact one's careless actions can have on another person's life. Fetal alcohol syndrome, or as it's commonly known as FAS, is a condition that is in a child that results from the mother consuming any amount of alcohol during her pregnancy. The child will then exhibit a variety of symptoms that oftentimes make his or her life rather difficult compared to a child without it. A real-life example of a child with this condition is the story of Adam in the movie and book, The Broken Cord. The Broken Cord tells the story of a single man named Michael who wanted to become a father. He then decided to adopt a 3-year-old Native American boy named Adam. Adam turned out to have serious health issues. These health issues included a smaller than average head size, the curvature of his spine, and the experience of many seizures. Some of these seizures were so dangerous and serious that they almost cost him his life. As his life progressed, Adam experienced many learning difficulties. By the age of 5, he could not tie his shoes, and he was still not able to be potty trained. He was later diagnosed with a mental illness. Adam's dad refused to believe this as he wanted to figure out what was truly wrong with his child. He worked with his son, trying to teach him in spite of his teacher's frustrations, and his life was devoted to researching the root of Adam's illness. Michael eventually discovered that Adam had fetal alcohol syndrome due to his mother being an alcoholic during her pregnancy. The diagnosis of FAS can be rather difficult as there are no tests or screening to prove the official diagnosis. To determine whether a child has fetal alcohol syndrome or not, you use facial features. Some of these features include microcephaly, which is a smaller than average head size, small palpebral fissures, which means small eyes or eyelids, epicandal folds, which are folding of the eyelids, and this is a trait commonly seen in children with Down syndrome. A low nasal bridge, a smooth philtrum, which is the space between the nose and the upper lip, a thin upper lip, and micrognathia, which means an undersized jaw. However, not all children who have FAS possess these physical traits. For example, Adam did not have any of these physical traits, causing him to be diagnosed with FAS later in his life. A later diagnosis is determined due to brain and central nervous system symptoms and social and behavioral problems. These come into play in the classroom and with other children. FAS can cause poor coordination, troubles with learning and processing information, difficulty reasoning and understanding the consequences of poor actions, mood swings, and hyperactivity. More symptoms include poor social skills and impulse control, trouble getting along with others, and difficulty adapting to change. Some symptoms are more serious than others. For example, one child had such issues with impulse control and mood swings that he ended up killing his best friend at only 10 years old. Although FAS can take a serious toll on one's life, it is manageable to live with. These symptoms can be overcome with therapy groups and support from others. However, it can be so serious that the average lifespan of an individual with it is only 34 years. Also, since behavior problems tend to remain an issue for life, it is uncommon to see them living independently. Also, many children with FAS are put up for adoption, making it rare to see them living with their biological mother. Is what you are doing right now going to affect someone else in a negative manner? This is an important question to ask ourselves. Although your actions may not cause as serious problems as FAS would, you can impact another negatively without you even realizing it. It is time to think for others and be selfless. This applies in many situations, especially the one we are in right now. With the world in a national pandemic, it is very critical to take the health of not only ourselves, but others very seriously. Precautions such as social distancing and wearing masks are very important for everyone around us. We all live in this world together and we're all connected, so it is time to watch out for each other. This fall, I will be attending the University of South Alabama, and I planned on exploring the medical field. I plan to obtain a degree in either nursing, biomedical sciences, or EMS. After my undergrad years, I hope to apply for and attend physician assistant school.
Many people have heard applying toothpaste to pimples and breakouts clears them up or speeds up the process. I as well have tried this, and it actually does more harm than good. Toothpaste actually dries out the skin and causes it to appear more scaly and irritated. Hi, my name is Mary Vanderlyn, and today I will be discussing with you facial hygiene and acne. In the fall, I plan to attend Troy University, where I will obtain a major in nursing. I have been in the biomedical science program for 3 years at St. Luke's. Growing up, I struggled with acne, and being in the doctor's office piqued my interest for dermatology. Dr. Scott Van Luke came and spoke to our class a couple times over the years, further sparking my interest. For my field of interest for my third year of biomed, I chose dermatology. I later shadowed a licensed esthetician named Elizabeth at Advanced Dermatology. An esthetician focuses more on skin appearances, while dermatologists focus on diagnosing and treating. Some fun facts about acne. The sun is not good for acne and breakouts. Anyone at any age can get acne. Chocolate does not cause breakouts. Acne is the most common skin condition in the United States. Mineral oils and other ingredients clog pores. And if over-the-counter treatments aren't working for you, it is time to see a dermatologist. There are 4 different types of acne I will be discussing with you today: whiteheads, blackheads, pustules, and cysts. The first type of acne is whiteheads. Whiteheads are dead skin cells, oil, and bacteria trapped in the pores. They appear as white raised bumps on the skin. They are caused by clogged pores or hormonal changes. Baking soda and water, or apple cider vinegar and water, are some at-home remedies to help treat these. Next are blackheads. Blackheads are whitened hair follicles and darkened skin debris trapped in the skin. They appear black, and charcoal, turmeric, and tea tree oil are some ingredients that you can use to treat these. Next are pustules. Pustules are pus, oil, and skin debris trapped in inflamed pores. They appear yellowish and red. Mild soap and water can help treat these. The last type of acne is cystic. It is the most severe. It is dead skin cells and bacteria trapped in oil ducts. They appear red and inflamed, and salicylic acid and hydrocortisone cream can help treat these. There are many different things that can cause acne. There are 150 different species of bacteria on your hands, so touching your face can further worsen breakouts and cause new ones to appear. Stress is also known to worsen breakouts and to cause new ones to appear. 80% of acne is due to having certain genes, so yes, genetics is part of having acne. There are many advantages of sunscreen. Sunscreen can help protect against sun damage, and it can also prevent squamous cell carcinoma by 40%. Squamous cell carcinoma is a common type of skin cancer treated. Sunscreen also helps maintain an even skin tone and prevent wrinkles. The image on the screen shows a woman under UV light. The UV light picks up and shows dark spots. This is an SPF chart, and according to this chart, it shows by the hours you spend outdoors and your skin complexion the right SPF for you. This chart can be found online, and it ensures that you are using sunscreen properly. Sunscreen should also be reapplied every 2 hours. Many of you, I'm sure, need a reminder on how to properly wash your face. Daily, you should use a mild cleanser and avoid products such as sulfate, mineral oils, and parabens, which can further clog your pores and irritate your skin. You should also exfoliate your face 2 to 3 times a week with a gentle scrub. You should avoid drying your face with a towel by rubbing it instead of patting it. Patting your face dry ensures that you keep your skin's elasticity because rubbing your face can cause more wrinkles to appear. After washing your face, you should apply a toner. A toner helps remove the dirt and debris that the cleanser did not, and it also helps balance your skin's natural pH. A moisturizer can help hydrate and reduce wrinkles. Vitamin C is another ingredient that should be in your facial products. Vitamin C is known to help brighten and even skin tones and reduce premature aging. The picture on the screen shows a woman before and after using vitamin C. On the after picture, you can see that her skin appears more even and the red inflammation has gone down. Antibiotics are a common type of treatment dermatologists prescribe to patients with severe or scarring acne. They are used for a short period of time, usually 6 to 8 weeks, to prevent resistance. They help reduce bacteria and fight inflammation. They are also often combined with other treatments. Some common antibiotics used are minocycline, tetracycline, and doxycycline. Topicals are another type of treatment dermatologists use, and they are also often combined with other treatments. They help control bacteria and unclog pores. They are used for patients with mild to moderate acne, and they can be used for any amount of time. Chemical peels are another treatment dermatologists have for patients with acne. They exfoliate and reduce the appearance of acne scars. They are most efficient after numerous treatments, and there is usually a burning sensation during the process. Healing takes up to 3 to 10 days. The image on the screen shows a patient before receiving chemical peels and later after over a course of a couple weeks. Some common do's and don'ts. Do pat your face dry with a towel. Do use sunscreen. Do use gentle facial cleansers. And do try tea tree oil and other natural ingredients. Don't over-exfoliate. Don't rub your face dry with a towel. Don't pop pimples. And don't apply a toothpaste. Many of us view celebrities as flawless and imperfect, when really many celebrities struggled with acne and skin problems. Some common celebrities that struggled with these are Katy Perry, Adam Levine, Miley Cyrus, Ashley Tisdale, and Rihanna. Some common statistics that we need to remember is that acne affects 40 to 50 million Americans. Almost 100% of the teenagers have a problem with this, and acne is not restricted to any age group. So remember, you are not the only one going through this.
I am sure not many of you know someone in your family who is a twin or a triplet. Being a twin or a triplet can be a very risky pregnancy. Many of you know my sister Chloe and I as being twins, however, originally we were triplets. My mom got pregnant through intrauterine insemination, along with her taking ovulation-inducing medications, she became pregnant with me, my sister, and her third baby at the age of 30. Halfway through her pregnancy, however, she discovered that there were complications and malformations with that third baby. A few weeks later, she discovered that that third child had died of the complications and the malformations. Today, I would like to discuss with you all how a multiples pregnancy can occur, the types of multiples pregnancies, and the complications that come along with this pregnancy. To begin, I would like to discuss the causes. There are several reasons that these pregnancies can occur. Common reasons that these pregnancies occur are due to previous multiples pregnancies, the family history, age and ethnicity, treatments, and in vitro fertilization. If a woman has previously had a multiples pregnancy, the chance of her having another one of those pregnancies is much more common. Family history also plays a huge role in having a multiples pregnancy. If a multiples pregnancy runs in the family, then the chances that another one of those women will have a multiples pregnancy is increased. Age also plays a role. If a woman is older than 30, the chance of her having a multiples pregnancy is also increased. Ethnicity is also a major reason why these pregnancies occur. For example, African Americans have the highest rate of having multiples pregnancies along with Caucasian women. Asians and Native Americans have the lowest rate of having these types of pregnancies. Treatments such as ovulation-stimulating medications and follicle-stimulating hormones are also known to result in these pregnancies. In vitro fertilization is commonly known to result in a multiples pregnancy because whenever the eggs are retrieved from the woman's uterus, they are taken back into the lab to be fertilized, and due to the high fertilization in the lab, it is known that these pregnancies can often occur to be multiples pregnancies. A pregnancy is considered multiple whenever a woman is carrying more than one fetus. If you will refer to the chart on the screen, you will see that women that are ages 35 and higher are recorded to have multiple pregnancies more than any other age group. It is common that a woman will have a twin or a triplet pregnancy, however, these can be greater than 4. For a pregnancy to be considered identical, the fertilization of one egg will have to split into 2 or 3 embryos. Being fraternal is often more common. This occurs whenever separate eggs are each fertilized separately. In pregnancies that are greater than 4, however, this can occur whenever multiple eggs are released and then fertilized, or if one or more fertilized egg divides into 2. More than 3 in 5 multiple births are premature. Because of the higher amount of fetuses in that birth, the greater the risk is for early birth and complications. Some common complications include premature labor, low birth weight, gestational diabetes, and preeclampsia. The most common complication is premature labor. This is an easy development that occurs whenever a baby is born before 37 weeks of gestation. Low birth weight often accompanies premature labor, and this is described as whenever the fetus is below 5.5 pounds. Preeclampsia is often common, and this occurs whenever a woman develops high blood pressure or hypertension during her pregnancy, which means that before her pregnancy, she did not experience high blood pressure, and most likely after her pregnancy, she will not experience high blood pressure. Gestational diabetes works similarly to preeclampsia. This means that before the woman was pregnant, she did not have diabetes, and most likely after that pregnancy, she will not experience diabetes. This is often believed to be because of the placentas increasing in resistance to the insulin produced within that woman's body. More serious complications do occur in a multiples pregnancy, one being twin-to-twin transfusion syndrome. This is described as when abnormal blood vessels begin to grow and develop, and they will flow unevenly within the gestational sac. One of those babies will become dehydrated, and this is known as the donor twin. The other baby, which is known as the recipient twin, will develop high blood pressure and produce too much urine, so much so that it can overflow the gestational sac. The excess fluid that is placed on the recipient baby's heart can often cause heart failure, and intrauterine growth restriction is pretty common, but it can be a very serious complication. This is described as when the growth rates for the babies begins to slow before 37 weeks. For twins, oftentimes their birth begins to slow at 30 to 32 weeks. Triplets can slow at 27 to 28 weeks. And quadruplets can begin to slow at 25 to 26 weeks, which becomes a very high-risk pregnancy. This is often believed to be because the fetuses are each competing for nutrients from the mother's body. Lastly, placental abruption. This becomes 3 times more likely to occur in a multiples birth. This is described as when the placenta detaches from the uterus early on and can become a very serious complication that affects the life of the mother and the baby. This year, I have had the best time in my biomed class. I was very fortunate to have Dr. Brandy Trammell from Mobile OBGYN to be my mentor. Because of my research, my job shadow, and my personal experience being a multiple, I've decided to continue my studies in obstetrics and gynecology and hope to treat cases of multiple births one day. This fall, I plan to attend the University of South Alabama, where I will be enrolled in the nursing program. And I hope to go on one day to become a nurse practitioner in obstetrics and gynecology.